Hi, my name is Dr. Erin Holsinger. I'm a pediatrician. I live in Stanford. I'm also the mother of a child who was diagnosed with leukemia when she was 5. So 6 months after she began chemotherapy, she'd lost all of her hair and her immune system was mostly gone. She was certainly no longer protected from all of the vaccine-preventable illnesses. And she began kindergarten with 28 other students. And I had to rely on the fact that those students were protected from those vaccine-preventable diseases in order to keep her from getting them. So my support of the bill is to keep children like my daughter Ella safe, the ones that count on others to be immunized because they themselves no longer have that immunity for various reasons. And I also feel strongly that medical exemptions should be given only to children who truly have the medical need for that. And as a pediatrician, I feel very strongly that those in the medical profession should be held accountable to the standards of care. And I think a lot of physicians in California are giving medical exemptions where they're not appropriate, and they should be held accountable for that. Children like my daughter deserve the opportunity to go to school and be safe.
That was perfect. And just tell me what you just told me. How's that?
Tell you where I trained and
Well, I just want
where I'm
you to-
from.
I just want you to tell me your name,
Okay.
and then I just want you to be comfortable talking to it.
Okay.
We're always
Okay.
nervous here.
That's okay. Okay.
Go ahead.
You ready? So I'm.
Go ahead and look at me.
Oh, look at you. Okay. My name's Dr. Carly Grovehog. I'm a family medicine physician who practices in Winters, California. I'm also the mother of 2 children. My daughter's 3 and my son is 5 years old. He'll be starting kindergarten this year. As a new physician, I've been lucky to be trained in a time when vaccine rates had been high enough to not actually see firsthand a lot of these preventable illnesses that now are starting to resurface, unfortunately. I'm having to actually learn and read about diseases like measles, pertussis that are coming into the clinic potentially now and having to be kind of prepared for and how to handle that public health situation. My grandmother actually developed polio in the early 1950s before the polio vaccine came into existence, and hasn't been able to walk since she was in her mid-20s. So that is a disease that I've actually seen firsthand and seen the effects it's had on her life. And so I am in support of this bill because these vaccines, I think in this day and age, it's easy to forget the importance of them because we haven't actually seen most of the devastating complications from these illnesses. But now we're starting to again, and I think that it's really important that we continue to encourage and support vaccinating children against these illnesses to keep that high amount of community protection, herd immunity, and allow only the children who truly have needs, who have indications to not get the vaccine. Those are the children who, I'm sorry.
Just start the sentence with the children who need. That was perfect. When you're ready.
Keeping the children who have true medical indications to not receive the vaccine, I've granted medical exemptions when that need is truly there, but it does need to be there in order to protect the community as a whole and all of the other children in our lives.
Perfect. Can you say, join me,
Yep.
parents and physicians in supporting SB 276?
Isn't that the camera?
Please, yeah.
Please join me, parents, physicians, in supporting the bill SB 276.
Do it one more time.
Did I say the right number? I doubted myself there. Okay, I'll say it again.
Say it with the same conviction that you say that vaccines work. When you're talking to a vaccine hesitant parent, say it with that same conviction. Vaccines work.
Okay. Please support me, family physicians, and parents in. Wait, I'm going to say it again. Please join me in supporting parents, physicians, in supporting the bill to. Okay, now I mixed up again. Now I feel like I'm in the end of Cuts movies. Please join me, physicians, parents, in supporting the bill SB 276. Is that better? Okay.
Just have a conversation with me, kind of.
And feel free to talk with your hands if you feel the need.
Yeah, be a little frustrated.
Okay, sounds good.
That's how you work. Whatever.
Not take the mic down. Okay, I'll try to remember.
So, Doctor, what's your name?
My name is Erika Rochandrawan, and I'm a family physician working in Woodland, California. I'm also the mother of 3 children, and they are 7, 5, and 2 years old. And I want to tell you, I have seen myself medical exception letters that state such things as the risks that are posed by family history of autoimmune diseases and allergies, and that those risks outweigh the benefits from the vaccines of these preventable diseases. And it just made me think, what diseases are we really talking about? We are talking about diseases that my grandparents were dying from, that all of us younger physicians, we haven't seen a lot of, but they were very, very severe and when my grandparents were younger. And the first thing they did when vaccines came out is they immediately took my mother and my aunt to get vaccinated when they first could do that, because they saw what polio was doing, what measles was doing, what other diseases were doing. Now we're not seeing that as much, but to say that a family history of autoimmune diseases or allergies is more of a risk than these vaccines that prevent these preventable diseases, that to me is completely shocking. And hearing that from a physician, I do think we need to be held accountable for things that we say that are really not evidence-based and that really are not to the best of our knowledge in medicine. As a parent, I really want that my child, when they were infants, that they were protected from diseases that they could not be vaccinated yet, such as pertussis or measles. And I rely on the other children to be vaccinated to protect my infant that is too young to get vaccinated. Also, children that cannot be vaccinated for diseases of their immune system or medications they have to take. Those children rely on all the other children to be vaccinated. And it is our duty and our moral imperative as parents and as a society to protect those that are more vulnerable. And that is why I strongly support holding physicians accountable for the kind of statements they make in terms of medical exemptions and adhering to what is evidence-based and what is truly true medical exemptions. And that is why I would like you to join me and parents and physicians in supporting SB 276.
Hi, I'm Leah Russin, and I'm the Executive Director of Vaccinate California, a parent advocacy group representing the tens of thousands of parents across California who know that vaccines work, and we trust our pediatricians. I hope you will join me, along with the many parents whose children are immunocompromised and rely on herd immunity to be able to send their children safely to school, in supporting SB 276, important legislation that will make our schools safe again.
All right, and I'll stand right here so you can look at me, okay?
Okay.
And try not to rock, please.
Like this, yeah.
Okay, what's your name?
My name is Amy Alfieri.
Dr. Amy?
Technically, I am a doctor. I have a PhD in Spanish.
So then, wait a minute, okay.
Not a medical doctor.
Gotcha.
Yeah.
Okay, and spell your name, please.
It's A-M-Y. Alfieri is A-L-F-I-E-R-I.
Okay, so what's your story?
I'm a parent. I volunteered with Vaccinate California back in 2015 when the Disneyland measles outbreak was happening. I was concerned for my infant daughter, who at that time was too young to receive her first vaccine against measles. So I volunteered with Vaccinate California and I supported SB 277. And I'm back again a few years later to support SB 276.
What's your feelings about the importance of it?
I think it's really important to protect the most vulnerable members of our community, such as babies who are too young to be vaccinated,
elderly or immune compromised individuals, children who are fighting leukemia, for example. So I feel really strongly that most children should be vaccinated. There can be exceptions for legitimate medical reasons, but what we're seeing in California is doctors selling medical exemptions to anti-vaccine parents. And so we have pockets of children who are unvaccinated for not true legitimate medical reasons.
And do you have any feelings on the accountability factor?
Yes, I think that these doctors who are issuing fake medical exemptions or medical exemptions for illegitimate reasons are profiting from this practice. They're charging parents a lot of money, and they're taking advantage of parents who've been misinformed by anti-vaccine propaganda on the internet or on television or everywhere in the media. There's a lot of misinformation out there. And so parents are scared, and then there's a couple of doctors who are bad actors who are taking advantage of this situation.
Do you remember the statement they asked you to make, looking into the camera?
Please join me.
Wait, look into the camera. And then when you finish, continue looking.
Please join me and other parents in supporting SB 276 to protect our community immunity and support public health.
One more time, include physicians.
Okay.
Please.
Please join me, parents, and other physicians in supporting SB 276 to support our community immunity and protect public health.
Awesome. This is in Spanish.
Okay. Soy una madre y apoyo la SB 276 porque creo en la ciencia. I start over. Soy una madre y tengo 2 hijos y quiero pedirles que apoyen la SB 276 porque necesita. Okay, I have to start over. Wow, okay.
All right.
I'm getting really nervous.
It's okay. 5 hours of sleep.
I know, for 3 days. I have crazy kids, so yeah, they drive me crazy. Soy una madre de 2 niños en California y quiero pedirles que se unan a nosotros en el apoyo de la SB 276. Necesitamos proteger la salud pública y proteger a las personas vulnerables en la sociedad, y por eso apoyo la SB 276, porque creo en la ciencia y reconozco la importancia de las vacunas.
Awesome. Okay, what's your name and how do you spell it? And look at me, please.
My name is Dawn Peterson. That's D-A-W-N. Peterson is P-E-D as in David, E-R-S-E-N.
And is there a doctor in front of it?
No.
Okay. What are your feelings regarding this subject matter?
Okay. I'm a mother of a 9-year-old boy, and when he was 5, there were measles outbreaks that were happening, most notably, oh, sorry,
Okay.
start over.
You made it.
Okay. I'm a mother of a 9-year-old boy, and in 2015, there were measles outbreaks occurring throughout California, including most notably at Disneyland. He was about to enter kindergarten, and I was concerned that while he was fully vaccinated, vaccines are very effective, but not 100% effective. And I was concerned that there would be increases in outbreaks of measles, mumps, chickenpox, what have you, that could threaten his health, even with that little bit of open window that vaccines might not cover fully. So I strongly supported SB 277. I came here and spoke at the Capitol about it and voiced my support. Now I'm learning, unfortunately, that there is a loophole in the way of medical exemptions that doctors can just sign by themselves without any kind of scrutiny. And the current bill, SB 276, is supposed to help close those loopholes, help make it a lot harder for unethical doctors to get around SB 277. So I am here to support SB 277 to protect my son and to protect other children in California.
Okay, say it one more time. Look into the camera, please.
Say what, the whole thing?
Yeah, what you just said.
Just the last part or the whole thing? Oh, okay. I am supporting SB 277. Oh, yes, okay. Please join me in supporting SB 276 as a parent and, I'm sorry, do you want me to include the physicians part? Okay. Please join me, parents and physicians, in supporting SB 276 for the health of our children. Thank you.
Okay, what's your name and how do you spell it?
My name is Karen Zanato, Karen, and Zanato is Zanotto.
Okay. Nervous?
A little bit.
Why? So feel free to talk to the hands.
Okay.
Okay, so what's your story?
Well, like many other parents, when the measles outbreak occurred in Disneyland, I had a young daughter that was too young to receive her MMR vaccine. And I worried about her, and I worried about all the other kids in California, in the US, around the world, that don't have protection against vaccine-preventable diseases. Since SB 277 passed, we have seen a big increase in the rate of vaccination here in California, but unfortunately it's not enough. Because there are physicians that are writing medical exemptions for kids that just don't need it, there are kids at risk that have to think about whether or not it's safe for them to go to school, whether the kid that sits next to them in class will go on vacation somewhere and come back with measles as a souvenir. So I think the SB 276 is important to make sure that doctors have oversight in this medical exemption process and that public health officials have a way to notify these families of kids that cannot be vaccinated if they have something to be concerned about, if there is a a disease outbreak in their area that they need to be concerned about. So I strongly support SB 276.
And what about the accountability of the physicians who are writing these?
Well, I have a huge problem with physicians that write medical exemptions without scientific evidence backing them up for their reasons for writing those exemptions. I think there's a lot of fear out there that is spread by anti-vaccine propagandists, and there are definitely physicians that are taking advantage of that fear to make profit for themselves.
Anything else you want to say on that, Steve?
I think that's it.
Would you mind making that same
Yep.
statement to the camera, please? Stand by. Okay, go.
Join me, as well as other parents and physicians, in supporting SB 276 to keep our community safe.
Excellent. Okay, what's your name and how do you spell it? And look at me, please.
My name is Dorit Rice, Doritreiss. I'm a professor of law at UC Hastings College of the Law. And the last time I was in this building, I was 7 months pregnant, and it was a hearing for SB 277, and I was worried that my newborn will have to face the ongoing risk of measles. I hoped we wouldn't have to be here again, but after SB 277, we saw a rise in fake medical exemptions. So now we have a bill in the process to try and fix that problem, to try and stop doctors from writing fake medical exemptions. I think it's an important loophole to close. I understand the concern of the parents who believe that vaccines are dangerous and think medical exemptions are the only thing that protects their children, but that's not a reason to make our schools less safe. We need to have schools that are safe from disease, and SB 276 will help close a loophole that prevents that. I hope everyone supports SB 276. Thank you.
Would you mind making your statement to the camera?
Mm-hmm. Should I start from the top, or?
No, just support,
Okay.
join me in supporting.
Join me in supporting SB 276 to protect our children.
You, physicians, and other parents.
Okay. Join me in supporting.
You,
Okay.
physicians, and other parents.
Join me, physicians, and other parents in supporting SB 276 to protect our children.
Join me, other parents, and physicians in supporting SB 276.
for what reason? Start over.
Okay. Join me, other parents and physicians, in supporting SB 276 to protect our children and protect public health. Okay.
Yeah, I was born here.
From that area?
Yeah, I was born in Santa Clara. So, yeah.
That's nice to be able to kind of come back and practice where you
It is, yeah. It is really nice. I think, well, especially the Bay Area, it's kind of hard to come back. Yeah, so, but
Where did you do your medical?
I went to Georgetown for med school and then, oh yeah, okay. And then Boston Children's Hospital for residency, yeah. So, yeah.
So a couple of quick things. What we're trying to do is kind of just tell us your name. Kind of
Okay.
From the,
And if I could ask you not to rock.
I'm gonna try. Okay.
trouble. Roll it again.
Okay, I'm gonna try.
Where you're at, and then talk about, we're trying to keep the message frame of being a parent.
Okay.
The position as
Okay.
possible.
Mhm.
Because that's kind of what is being, the frame that's being set up, is there's a challenge that's about the patient relationship.
Uh-huh.
So if you might want to say to that as a
Okay.
physician and
Okay.
as a mother. And a
Okay.
parent.
Okay.
Great. And then at the end, we'll have you probably say some yes on SB 276 stuff.
Okay.
Does that work?
Sure.
Okay.
I'll try.
And I'm going to stay here so you kind of look at me like we're having a conversation.
Okay. Okay.
Does that help?
Yeah.
Okay.
I think so. Okay. Anytime? Okay. My name is Dr. Elizabeth Copeland, and I want to put my full support behind SB 276, both as a physician.
Excuse me, is she talking to you on this, or?
Oh, where do you want me to?
Well, if she's making a statement to the
Okay.
camera, then look at the camera, but she's telling you her story.
I don't care. Talk to you?
Yeah.
Okay.
That's all right.
It's okay.
But as quiet as we can, too.
Should I start again? Okay. My name is Dr. Elizabeth Copeland, and I want to offer my full support for SB 276, both as a pediatrician and as a parent. I feel it's essential to believe in science, to create herd immunity, and help protect the small humans who we take care of every day in pediatrics, and create a safe space for our community. What else?
I wasn't paying attention, I'm
It's-
sorry. But do you want her to do it?
I can say whatever you want me to say.
Do you want her to take the foot off and do it as a mom and a pediatrician?
Sure. Okay. Okay. My name is Dr. Elizabeth Copeland, and I just want to speak to the importance of SB 276 as a mother and also as a pediatrician. In my line of work, it's absolutely essential that doctors and patients have amazing relationships and trust that's built. And this bill will help pediatricians have a genuine, true, evidence-based relationship with those families. As a mother, I want safety in the schools and in our larger communities because herd immunity is real and it's based in science.
Are you hearing more and more parents coming in that are concerned about some of the outbreaks that might be happening?
Absolutely. You know, I have a few patients, very few in my practice, who have valid medical reasons for not being vaccinated. In particular, I think of one who is unable to get his MMR booster because he is on immunosuppressants. And every time I see his mom, they've got 3 kids and I see them all the time, his mom's like, when can he get vaccinated? Because I am so scared of measles, as she should be in our community. So yes, I absolutely hear it from patients and parents all the time.
Can you look in the camera now and say, join me, parents and physicians, in supporting SB 276?
And when you finish, continue looking at the camera.
Okay. I'm like a little nervous. Like I don't really do this all the time. Okay. Okay, say that again. What am I supposed to say? So it's join me. Uh-huh.
Parents and physicians
Okay.
in supporting SB 276.
Okay. Join me, parents and physicians, in supporting SB 276. Oh, please.
Oh, you weren't recording?
No.
Do you want to speak about like learning right now and then future pediatrician? Because you want to actually be a pediatrician.
Okay, well, yeah, let's talk about that.
Perfect.
Being a pediatrician, why you want to be a pediatrician, and why you're here to talk about this issue.
I want to be a pediatrician to protect kids from people like that, but I don't think that's a very friendly message.
Right. There's probably more nuanced ways to say that, but the way you say that is kind of why it's important to make sure that we have better information, better facts, and why being, I think the story about being a pediatrician is probably the most compelling piece with all the other facts that we'll bring out. Is that fair?
Yeah.
So tell us what your name is?
My name's Sean.
Sean, and where are you from, Sean?
I'm from Davis.
Okay. Where are you, where are you interning right now?
I'm a medical student at UC Davis Medical Center.
And you want to be a pediatrician?
Yeah, I've wanted to be a pediatrician for a long time. So I'm in support of SB 276 because it's sort of a safeguard, because there are a lot of things and a lot of people that can sort of go against the grain. And while any individual might think that that's a good idea, when you get a big enough group, that's the detriment to the community.
Hi, my name is Karen Chung, and I am a medical student at UC Davis School of Medicine. And I really think I'm in support of SB 276 because this is really the medical community policing ourselves. It's us trying to say that we are preventing these folks who may not be using this power as a physician in the right way, and us, the CMA, the medical community, putting their foot down and saying no.
My name is Michael. I am a medical student at UC Davis School of Medicine. I'm also a parent, and I feel strongly about SB 276 because as a parent with a child that's in school, that they are protected against vaccine preventable diseases that some have been wiped out for a long time and are now coming back because of misinformation, because doctors aren't doing what they're supposed to do. As doctors, as scientists, we're supposed to use evidence-based medicine. We're supposed to use all of the studies, the vast literature that's out there that supports these bills. And some of these doctors that aren't following that advice are a detriment to the profession, to our community, and especially to our kids.
My name's Carly. I'm also a UC Davis medical student, but I come from Stanislaus County, and there was actually an outbreak of measles in my community. So beyond just the individuals who are vulnerable and can't be vaccinated because they have medical conditions where they cannot be, herd immunity is a real thing, and when herd immunity starts to break down, we start to see the effects in vulnerable communities like my community. So I am doubly concerned as both a student, but also for my community.
So we all look into the camera, and then on 3 say yes on 276. Ready? 1, 2, 3.
Yes on 276.
A little bit robotic. A little less robotic.
Oh, too loud?
1, 2, 3.
Yes on 276.
Got it? Cool. Thank you, guys.
Okay,
Okay.
so I'm on a 2-shot. You want a single?
Well, let's just do something a little different with this one. That looks great.
My name is Cindy Sherwood. I'm from Los Altos, and I support SB 276.
My name is Susanna Sherwood. I'm from Orange County, California, and I support SB 276.
I got involved in this both as a parent and as a former journalist, getting very frustrated. We were in Orange County during the measles outbreak that started at Disneyland, and seeing the amount of misinformation and hysteria over something that has saved countless lives in the last 100 years. And my fully vaccinated daughter helps protect the community. And measles in 2019 should not be making a comeback, and doctors shouldn't be able to get away with writing fake medical exemptions that is destructive to public health.
Anything else? You would have to.
I don't know.
Is your mom just trying
I know. No, I'm just trying to think. I can't.
All right.
Sorry, I'm very bad at
That's
speaking.
Okay. I hate
Were you there during the outbreak? Is that
I don't really recall. Honestly.
She was.
Okay.
Well, she was
I don't.
very busy in high school, but I can tell you that at one point there was a student who there was exposure at her high school.
Do you remember that?
I really don't. I would say, I know the camera's on, but not as
What happened to you, Vanessa?
Yeah, okay. My angle here is probably as a biochemistry student doing biochemistry research. I think it's incredible that we live in a time with such great scientific advancement, but with pervasive ignorance in the community, all of that achievement and knowledge and advancement is essentially wiped out. And so I guess that's where I'm coming from here, and I'm just not quite sure how to say that articulately. Okay,
You
good.
did. That was excellent.
All right.
So you want us to say something together?
I did. Daughter, right?
Yes.
Could you say, join us and families and physicians in support of SB 276?
Should I do an arm?
Yeah.
Okay.
Okay. All right.
Join us
Join
and
us.
families and physicians in support of SB 276.
Are we both saying in unison?
I think we are.
Okay.
Or am I saying that?
Yeah, that would be great.
Okay. Join us and families and
No,
physicians.
why don't you just say it?
Okay.
Into the camera.
Okay.
3, 2,
Join us and families and physicians in support of 276.
Let's try
Oh,
one more time.
okay. Sorry. Join us and families and physicians in support of SB 276.
Wait, can we do it one more time?
Yeah.
I'm perfected.
No, that's
We
fine.
appreciate it. We're trying to run
This
your
is
daughter.
why I was not in front of the camera.
Okay, well,
Okay.
this is why you were directing all that time. Okay, so look at your daughter,
Okay.
and then look at the camera and say,
Okay.
when you say join us, look at her, glance at her, and then come back.
Okay.
Go.
Join us and families and physicians in support of SB 276.
What's your name and how do you spell it, please?
Hi, I'm Dr. Galen King, Galen King.
Go ahead and look at me, please. And what's your position on this bill?
I'm in support of SB 276 because I think it's going to protect the children, the patients that I see who can't get vaccines. I don't think that physicians should be writing these exemptions and abusing their powers in order to create hysteria and help facilitate these outbreaks of measles, of preventable diseases that shouldn't be around in 2019.
And, I mean, that's pretty good question.
I think it's good. Did you want to add anything else specifically?
Not really. I don't really have anything else to add.
Do you have any experience dealing with this?
I do have patients who have not gotten their vaccines, and they do pose a threat to some of the patients that I see, especially those who are too young or have medical conditions that can't get vaccines in my office.
Say it again.
I do have experience with patients who have not gotten their vaccines and who do pose a threat to the patients that I have who are medically compromised or can't get vaccines for other medical conditions. And they do pose a serious threat. I don't really like. Yeah, I want to say that again.
Okay, stand by.
Sorry.
All right, good. Here you go.
I do have experience with patients who have not gotten their vaccines, and they do pose a serious threat to the patients that I see every day.
In the camera, I want you to say, join me and physicians throughout California in supporting SB 276.
Can I say also healthcare professions? Because I'm a dentist.
Yes.
Yeah.
Join me and healthcare professionals throughout California.
Join me. Oh, sorry. One more time.
Join me in
Healthcare professionals.
throughout
Join me and
California
healthcare
in
professionals.
support of SB 276.
Join me and healthcare professionals in supporting SB 276.
Join me in
One more time.
healthcare professionals throughout California.
Okay. Join me and healthcare professionals in supporting SB 276.
Awesome.
Thank you.
We're going to do two. So there's like two different messages.
Name and how to spell it, please.
Margaret Parsons, Parsons, and that's Dr. Margaret Parsons.
Look at him.
Yeah, we're going to have a conversation. Go ahead, drop in a message.
I'm Dr. Margaret Parsons, and I'm here speaking on behalf of the 44,000 member physicians of the California Medical Association. We are here in support, strong support, of SB 276 to protect the children of California. Measles and other diseases such as pertussis are preventable. We need our kids vaccinated. Vaccination rates, 93% with 1 shot, 97% with 2 shots. Those children are 97% protected. Yet we are finding in this state areas where vaccination rates are down to 50%. If we protect those children, we will prevent diseases. Measles causes death. We do not need to see that in our country and our state.
Good. Forceful, like it.
Are the shots clear when I said 97, 93? Is it's acting like vaccination rates and separating it from if you get your 2 shots versus vaccination rates? You understood it? We're good? Okay. I just kept going, figuring I can redo it.
Yeah, let's do it into the camera. That's what you've got to complain. I like it.
So you're just talking right to the left.
Okay.
Do you know what you're going to say?
You want me to redo that one, or am I doing the second one?
Do the second one.
Okay.
Go ahead.
I'm Margaret Parsons, a physician here in California, speaking on behalf of the California Medical Association, our 44,000 doctors. Why do I believe in vaccination? When I was a medical student, I remember a case of an immigrant who had not had measles vaccination, had had measles, the encephalopathy and the brain swelling that comes with it. The kid had disease that he could never recover from. He was unable to walk. He didn't have control of his limbs. I remember my pediatric neurology faculty at that time saying, we don't see this. We're a vaccinated country. We eradicated measles. If we do not get our vaccination rates back up and protect our entire state, all the kids, and indeed nationwide, it's an issue. Vaccination saves lives, prevents disease, prevents death, prevents kids from not being able to walk. Support SB 276.
Good.
You didn't say you were a doctor. You did say you're a physician. You said you're Margaret Parsons, a physician.
Do you want me to say Dr. Margaret Parsons?
I mean, I think that's okay.
Either.
Into the camera, join me and the 44,000 physicians with the California Medical Association in support of SB 276.
You ready?
Join me and the 44,000 physicians of the California Medical Association and support SB 276. Thank you.
Good. Good.
Hi. Hi, my name is Dr. Sonia Khan. I'm a board-certified pediatrician, member of the American Academy of Pediatrics, and I would like to invite you to join me in supporting SB 276.
I apologize. Did you say it?
Hi, my name is Dr. Sonia Khan. I'm a board-certified pediatrician and a member of the American Academy of Pediatrics. I invite you to join me in support of SB 276.
Can you talk to me about why vaccinations are so important in your practice?
Sure.
Stand by.
So I've been working in pediatrics for over 30 years, and I am a survivor of the measles epidemic in Los Angeles in the late 1980s and early 1990s. There were 12,000 cases there. So I'm an eyewitness to the children that have actually died of these diseases before we brought vaccines to radically change the practice of pediatrics in America.
That's compelling.
There's more.
Keep giving it to us.
In 1981, prior to medical school, I was a biochemist and worked directly in the research lab that found the final correlation between human papillomavirus and cervical cancer. I prepared 65 tumors with my own hands to analyze them, to also find out whether herpes simplex virus was involved, which it wasn't. This was one of the first seminal studies to prove the correlations that had been identified in the 1960s. Since that day, over 30 years of work, we produced the Gardasil vaccine that we have today that is radically dropping the cervical cancer rates in young women.
What concerns you about the fact that we're having this discussion in 2019?
My concern is that vaccines are actually a victim of their own success. And so many people have never seen this disease that they dismiss it as trivial. It's not easy to understand what you haven't seen. And I have some sympathies to parents who have made this correlation between something devastating happening in their lives just after a kid got a vaccine, that don't have the scientific chops to understand that correlation does not equal causation. And so now we're faced with a tremendous burden of communication to our nation's citizens and explain to them that there's more behind the story and that the work has been done and that we know that these are not the causes of the terrible problems that they have in their families.
We get two shot. That if you could look into the camera, say, join me, other parents and other physicians.
My daughter. Yeah. Our hands, yeah, good.
Can you join me, parents and physicians in support of SB 276?
Please join me and parents and physicians and my vaccinated daughter in support of SB 276.
Say it one more time. This time when you say my vaccinated daughter, look at her and then glance back. Glance at her and then come back to the
Sure.
Go.
Please join me, physicians and parents, and my vaccinated daughter in support of SB 276.
That's awesome. Yeah.
Would you say your name and spell it, please?
Sure. My name,
We might.
Can you spell your name?
okay. I'm Dr. Deborah Donlin. First name is Deborah, last name Donlon. And my specialty is family medicine.
He's talking, Mike.
Okay.
Let's do the camera.
Okay, to the camera.
Let's speak into the camera.
Speak into the camera. Okay.
Talk to us about your support of SB 276
Sure.
and what it means to you. as a
Sure.
physician.
Okay.
And you're free to talk with your hands too. if you don't
Talk with my hands. Okay.
You're free to.
I'm free to. Okay. All right. So I am Dr. Deborah Donlin, and I practice in Santa Rosa, which is in Sonoma County, one of the beautiful counties of California. And I am here in strong support of SB 276. I am the medical director of a large federally qualified health center in Santa Rosa. We take care of 10,000 patients. I'm also the interim chief medical officer of Santa Rosa Community Health. And in our county, especially the western portion of our county, we are currently in a crisis where a large number of our patients are not vaccinated. 3 of our schools in West Sonoma County have vaccination rates in the range of 50%, which means that we are losing our herd immunity. Our children who are not able to be vaccinated because they're too young for vaccines, such as infants younger than 2 months, or children that have medical conditions that lead to immunosuppression and are unable to receive vaccines, are at risk because we have such low vaccination rates in our county. In my own practice, I have never written a vaccine exemption. Those should be incredibly rare. I have never met a family for whom that was appropriate. I have been asked by parents to write vaccine exemptions, but because their children were healthy, I wrote letters to the school saying that they were fully eligible and healthy enough to receive vaccines. And many of those families have returned to receive their vaccinations. So I recommend that other physicians take a similar approach.
That was really good. Anything that you think we're missing? Is that a new development, that drop in the vaccination rate? 50% incredibly low.
It's very low. We have 3 schools in Sebastopol that are in the top 5 for lowest vaccination rates in the state. So it's a big problem for us locally. We're waiting for our measles case, unfortunately.
No, nothing yet.
Nothing yet. Plenty of pertussis.
Can you say, look in the camera, join me and physicians throughout California in support of SB 276?
Join me and physicians throughout California in support of State Bill 276. Oh, okay, I'll say it again. Okay. Join me and physicians throughout California in support of SB 276. Got it.
What's your name and how you spell it?
My name is Linda Judah, Linda. Last name is Judah.
You're welcome to talk with your hands.
Okay. Okay.
So tell us your story.
Okay. Hi, I'm Linda Judah, and I'm a science teacher in Sonoma County, California. And I've come here to Sacramento today to advocate for SB 276. This is an important issue to me because I teach science, so I understand some of the science behind it. And while I have sympathy for the folks who are maybe fearful of vaccines, I've seen firsthand the effects of people who don't get vaccinated. I've seen students be out for a week and a half or more with whooping cough and come back and try and recover from that and get caught up on their schooling. And those are the healthy students. And it's even scarier for the ones who aren't able to get vaccines, for the people who could be at serious risk of very, very serious illness or even death. So it's very important that we maintain our herd immunity and keep our vaccination rates up. Please join me in Vaccinate California and supporting SB 276. Thank you.
You could say, that was really good, by the way. That was good. You could say, I'm here as a teacher, but more importantly as a parent.
Sure.
Asking you to support SB 276.
Mm-hmm. I'm here as a teacher and more importantly as a parent, asking you to support SB 276.
Good.
Okay.
What's your name and how do you spell it?
Hi, my name is Dr. Monica Asnani. It's Monica Asnani. I'm a pediatrician from Los Angeles. I'm here to support SB 276 because although SB 277 was a great step forward, it left some loopholes, and our community vaccination rates are still too low. We are still seeing outbreaks of whooping cough and measles. Children are being excluded from school. Children are becoming sick. And this new law, SB 276, will close those loopholes and provide necessary oversight for excessive medical exemption writing. Please join me and physicians and parents and Vaccinate California in voting yes on SB 276.
That's really good.
Lydia will be right back.
Okay, what's your name and how do you spell it? Go ahead and look at me, please.
My name is Kathy Hall, Cathyhall.
And you're with?
I am with the California State PTA. Hi, my name is Kathy Hall. I am the health advocate with the California State PTA, representing its 250,000 members here in California. We stand behind our resolutions, immunization awareness and education programs, which seeks to educate parents on on the risks and repercussions of not vaccinating, and on our resolutions, measles vaccinations, which we encourage legislators to pass legislation to get all eligible children vaccinated. We see that our most vulnerable children are at risk when herd immunity is reduced, so we urge every parent in California to vaccinate every child who can be vaccinated. We stand behind SB 276 that furthers this goal. Thank you very much. Stand with us, the California State PTA, and with other healthcare professionals and parents and grandparents to support this bill.
Thank you. One more time, though, when you say, please stand with the California Parents Teachers Association and its 250,000 members in support of SB 276.
Okay.
Okay, ready?
Please stand with the California State Parent Teachers Association and its 750,000 members to support SB 276.
Thank you.
Thank you.
Come back.
Okay, tell us your name and how do you spell it, please?
My name is Ricky Edelman, Rikkiedelman.
You are?
I'm Catherine Falk, Katherine, last name F as in Frank, ALK.
My name is Ricky Edelman. I'm a parent and a teacher, and I'm immune compromised, and I support SB 276.
And I'm here as a friend and an advocate of vaccines, and I support SB 276, and I ask that you join us and Vaccinate California to do the same. Thank you.
Tell us a little bit more about being immune compromised and what that means.
So I have autoimmune disease, as do thousands of Californians, and in order to save my life, I need to stay on a medication which makes me unable to have a functioning immune system or form new immunities. I cannot take live vaccines, and the ones that are not live vaccines do not work on me, which is why it's really important, and my students and my children depend on me to be healthy, and for that to happen, I need all of them to get their vaccinations.
So basically, you're at risk if your students aren't vaccinated.
Yes.
Can you elaborate on that, please? Or just
Yeah.
say that?
So when my students aren't vaccinated, I am at risk.
I'm sorry, could you tell the story and then
Okay.
repeat that? Just so it's
Like thousands of Californians, I have autoimmune disease, and in order to save my life, I have to take a medication which stops my immune system from functioning properly. I can't have live vaccines, and I can't have vaccines at all. But in order for me to function, the students who depend on me need to be vaccinated.
That's great, if you could say, join me. Join me and vulnerable communities of California in supporting SB 276.
Join me and the vulnerable communities of California in supporting SB 276.
Say it again, say us.
Okay.
Wait,
Should I,
yeah.
should we talk at the same time or
Can
just?
you do it?
Yeah,
All right.
sure.
1, 3,
Okay.
3, 2, 1.
Join us and vulnerable communities of California in support of
Sorry.
SB 276.
Okay, sorry. Join us and vulnerable communities of California in support of, okay, I can do it this time.
3, 2,
Join us and vulnerable communities of California in support of SB 276.
Okay.
what's your name and how do you spell it?
My name is Jessica Rivera, Jessica-Rivera.
Tell us about yourself, Jessica.
I am a mother and a microbiologist, and in my career, I am actually a science writer. My focus is on global infectious diseases, so I've actually seen firsthand the impact of not having access to vaccines readily available.
And tell us a little bit about some of maybe the myths that you had to work to uncover to write on.
Yeah, a lot of my work is also to dispel myths about vaccines and just general misconceptions about how they work. And so I work with a lot of parents to help kind of translate some complex science and make sure that they're understanding a lot of the information that's available online.
So you've seen different episodes throughout the world.
Yes,
Can you tell us about
yes.
some of those?
Yeah, I've worked in places in Africa, places in South Asia, and I've seen some of the desperate measures that mothers take to get their kids in line for vaccines, sometimes spending their whole days waiting just to have the chance to be vaccinated.
What do you subscribe to changes here in the United States to global vaccine rates too?
I think what we have here in California is a privilege, and I'm really thankful for SB 277, but I agree that there are many loopholes in 276 that allow people to kind of take for granted what we're doing to protect our children, especially those who can't get vaccinated.
Loophole 276 or 277?
I'm sorry, loopholes in 277.
You want to have you say that again?
Yep. I'm very thankful for SB 277, but I'm also aware that there are some loopholes there, so that's why 276 is incredibly important to make sure that we close them and make sure that we're not taking for granted what we have readily available here in the States, especially here in California.
Okay. Y en español.
Soy madre y yo apoyo esta ley y vacunas porque quiero proteger a mis niños y también los niños que están demasiado débiles para ser vacunados.
I want you to say something into the camera about why facts and science matter, and that's why you're supporting SB 276.
Yeah, I think every parent wants to be informed, and I think science can be sometimes really complicated and hard to understand, and we don't want that to be a way to act in fear. We want to help people understand that there are so many resources out there to help translate that for you. I'm here as a resource as well to help make people understand, but science, the research that has been done in vaccines is so important and so valuable and has been proven to really protect our children. So let's support the science, let's support SB 276, let's support the pediatricians that are trying to protect your kids.
Perfect.
Great.
Say your name and spell it, please.
Lisa Meneses, Meneses.
There's the camera. Okay, go ahead and look right at the camera. Tell us your story, please. And you're free to talk to him.
Okay. So my name is Lisa Meneses. I'm a pediatrician and a mother of 3, and I support SB 276 because not only does it continue the work of SB 277 to protect our children and our communities from detrimental and potentially fatal diseases, it does protect those who cannot get immunizations for medical reasons, and it ensures that they are still able to get them.
Are you seeing more, you're pediatrician,
Mm-hmm.
are you seeing more and more parents coming in concerned about communicable disease?
On an everyday basis, I work with parents who are very concerned about their children's health and safety, and as a mother, I can relate. And so many times on a daily basis, I tell them that I would never ask them to do something for their children that I wouldn't do for my own children. My children get shots, I get my shots, and we're all on the same team to make sure that their child stay healthy and live long, healthy lives.
Why don't you say that, again for me, because it's really powerful. I would never ask my patients to do something for their children that would for them.
Look at the camera.
Okay. So on a daily basis, I work with a lot of parents who are concerned about the health and safety of their children. And I can relate as a mother, because I would never ask them to do something for their children that I wouldn't do with my own. I get my shots. My children all have been vaccinated. And so I just have to remind them that we're all on the same team, that we want their child to be healthy and safe, and we want them to live long, productive lives.
If you could just say, in the camera again, say, join pediatricians and parents throughout California in support of SB 276.
Join parents and pediatricians all over California in support of SB 276.
Can you say one more time, except for lead with pediatrician, then when you say parents, say like me?
Okay. Join pediatricians and parents like me all across California in support of SB 276.
Can you hold them up just a little bit? What's your name and how do you spell it, please?
Alyssa Autry, A-L-I-S-A,
And scoot that way so we can hear you. Go ahead.
A-W-T-R-Y.
Okay, and are you a doctor or anything?
I'm a physician.
Okay, so do you want doctors?
Yes.
Okay. Go ahead and tell us your story, please.
My name is Dr. Alyssa Autry, and I am a family physician in the West County of Sonoma County, which has the lowest vaccination rate among school-age children in the state. So I get to see every day the dangerous effects on my patients and on my own family of the decreased herd immunity in that area. That's why I support SB 276.
Can you say, this is your only child?
This is my second child.
Second child. Talk about, as a mother, just the importance of getting vaccinating your children.
Yeah, so as a mother, I vaccinate my own children on the recommended CDC schedule. My youngest child is too young to be fully vaccinated, and so I consistently live in the state of unknowing, knowing that he's routinely at the library and in parks, at schools, exposed to kids who aren't vaccinated before he can be immunized himself.
Join parents and physicians in support of SB. Please join.
Excuse me, so if the kid makes any more noises, please don't respond, just because we'd like to capture that and not the audience, if possible. Thank you. Go ahead.
Please,
Go ahead, where do we go? Wrong foot.
please support parents, or please join parents, family physicians, and their babies. Okay. Please support, sorry. Okay. Please join parents, family physicians, and their babies in support of SB 276.
One more time, and this time when you finish, look at your baby.
Okay. Please join parents, family physicians, and their babies in support of SB 276.
My name is Dr. Edna Prieto, E-D-N-A-P-R-I-E-T-O, and I'm a physician in Berkeley, California.
Great. Share with us your story, please.
I support SB 276 as a physician for the well-being of our communities. And as a new parent, I fear that when I take my kid into the world, I'm exposing him to diseases that have readily available and effective and safe vaccines. Just like these diseases, both the fear and the diseases are preventable. We, at this age especially, I need the herd immunity, he needs the herd immunity to stay safe.
So as a new mom, this is like new territory for you. I mean, were you like doing your homework before you delivered?
Well, as a physician, it's not new homework, but there's new feelings that come up as a new parent. I know the evidence, I know the recommendations that I've made, but now more than ever, they hit close to home.
As a physician and as a parent, I'm asking you to please join me in support of SB 276.
As a physician and a parent, I urge you to please support SB 276.
Wait, hold on. Go.
As a physician and a parent, I urge you to please support SB 276. As a physician and a parent, I urge you to please support SB 276.
Thank you.
Hi, my name is Dr. Brian Prystowski. My first name is spelled B-R-I-A-N. Last name is spelled P-R-Y-S-T-O-W-S-K-Y. And I'm a pediatrician from Santa Rosa, California in Sonoma County. Here with me today are a couple nurses from my community. Is it important that I name them?
You can.
Do you guys want to introduce yourselves? Yeah, why don't you introduce
I'm Laurel Leroon, L-A-U-R-E-L, last name Y-R-U-N, and I'm a California credentialed school nurse.
Lori Johnson, L-O-R-I-J-O-H-N-S-O-N, and I'm a family nurse practitioner from Sonoma County originally.
Thea Dolan, D-O-L-A-N. I work at the local Santa Rosa Community Health Clinic as an advice nurse.
My name is Wendy Peterson, W-E-N-D-Y-P-E-T-E-R-S-O-N. I am a retired RN who specialized in women's and children's health with a focus of neonatal intensive care nursery.
As you can see, we're a very broad group of professionals coming from Sonoma County. And this sign that you see in front of you that says, "We also love your kids," is really important for us, I feel like, in healthcare to make sure that the greater community remembers. Because I think in some of these partisan issues, when we're talking about a bill that affects the public health, people forget that healthcare providers have this premise: we sign a commitment to do no harm to any parents or to any of their kids as a pediatrician. So I want everybody to remember that we in healthcare that support Senate Bill 276 also love your kids. You might be really impressed by the mural in front of you that's actually made from shot caps from vaccines. So all of these caps on here represent a saved life from a vaccine that we were able to give to a patient. Please join us from Sonoma County and Santa Rosa, California, the healthcare community, in supporting SB 276.
Perfect. Last tagline, just say, join us and healthcare professionals throughout the state in support of SB 276. I don't, that might be too much. But
Was that too long?
Decord.
Oh, all together? Can you say it one more time?
Oh,
What
yeah.
are we supposed to say?
I don't think we should all five together.
Yeah.
Just
How about you?
Oh, okay.
Join us and healthcare professionals throughout the state in support of SB 276.
Okay. Please join us and healthcare professionals all over the state in support of Senate Bill 276.
Stay there. Don't leave. Please. Please continue smiling. Just kidding. Okay, stand by. Do you want to talk with your hands?
They might show up. Yo soy la doctora Edna Prieto, trabajo en Berkeley, California. Como una madre nueva, tengo miedo que cada vez que saco a mi hijo al mundo, lo estoy exponiendo a enfermedades que tenemos vacunas que son efectivas y que no hacen daño. Este miedo, como estas enfermedades, son prevenibles. Nosotros, especialmente él, estamos dependiendo en la inmunidad de la comunidad porque él es muy joven todavía para tener todas sus vacunas. Por favor, únase con nosotros a apoyar a SB 276. Oh, goodness.
Thank you.
Me llamo Dr. Prstowski, yo soy un pediatra de la Condado de Sonoma, en California. Y en Santa Rosa, en nuestro pueblo, tenemos un montón de pacientes ahora que son débiles de su sistema de inmunidad. Casi nadie puede ver a estos pacientes porque lo que pasa es que tienen sistemas de defensas compromisos de enfermedades de tipos de cáncer o de otros problemas de su sistema de inmunidad que nació con ese problema. No es problema de parte que alguien quiere para su bebé. Yo soy también un papá de 2 niños. Mis niños son... Sorry, I got confused. Okay. Me llamo Dr. Brian Prstowski, yo soy un doctor pediatra del Condado de Sonoma y nuestra ciudad de Santa Rosa. Yo tengo 2 niños y mis niños tienen sus vacunas. Y una razón muy importante es que en nuestra ciudad, en mi práctica de pediatra, tengo algunos niños que tienen sistemas de defensas muy abajo por diferentes razones, como tratamiento para cáncer o tratamiento para diferentes problemas que nació con un sistema de defensas abajo. Para estos niños que no pueden recibir vacunas, es muy peligroso porque las enfermedades que decimos sarampión y tosferina son enfermedades fuertes, pero en casos de esos niños son graves y en algunos casos no es muy bueno. Lo que queremos, como yo soy pediatra, yo soy papá, queremos que todos los doctores, padres y personas que entienden estén sufriendo de esos padres que tienen niños con sistemas de defensas bajos, por favor, how do you say vote? What?
You're doing great.
Okay, thanks. Por favor, apoya para Can I just say SAB? That's fine. Okay, thank you. Okay. Ready? Por favor, apoya para SAB 276 con todos de nosotros, pediatras, padres y personas que cuidan para niños que tienen sistemas de inmunidades bajos.